class. This week is week 2 on our HIT260 class, and our discussion revolves around compliant queries. And then we also have a module regarding the AHIMA guidelines for achieving a compliant query practice. I guess it's actually AHIMA and ACTIS. So I wanted to talk about this just kind of briefly because queries are a really important thing to understand as you become professional coders. So more than just kind of reading through this, I also want to give you a couple of tips here about this document and really what's important. But I really want to just kind of talk about queries and why they are important, what are they, and kind of how they fit into the job of a coder. So what we're looking at here is the module for week 2. It is guidelines for achieving a compliant query practice. What you will notice here is that this lesson is 45 minutes long over here on the left hand side. Be prepared to take notes. Do you agree? So you have to click yes, and then submit that. And then there is also the document. There's a link here to the PDF. So I would 100% suggest that you click on that link. I've clicked on it, and so this is the PDF here. We're going to look at this a little bit and download this. Download this to your computer so that you have it to study with, because this is going to be something that you're going to need probably as you begin to prepare for your certification exam. And then also it's a really good thing for the real world, right? So that's really what I wanted to kind of talk about in my video here. So I'm not going to try, I'm going to try not to talk too much, but I really want to talk about what is a query. So a query is kind of a funny word. It just means a question, right? So in this case, we are asking, typically we're asking the doctor or the medical provider a question about their documentation. So as a coder, we remember the first rule of coding is if it's not documented, it didn't happen, right? So kind of what goes hand in hand with that is if it's not documented well, then it can't support our codes, right? So when you're coding, right, and again in the regular work of coders, when we have coders who are coding and the documentation is insufficient, it is incomplete, potentially conflicting, right, that's going to be when you are going to have to stop what you're doing and send a query to the clinician, to the doctor, to say, hey doc, well, was it the right side or the left side? Right? Or is it diabetes or pre-diabetes, right? One of those things to kind of clarify the documentation. The provider is going to need to amend that documentation. And then you can go along, once they've amended that, then you can go along with your life, right? And then kind of finish your coding. So one of the things that's extremely important when it comes to queries is ensuring that our queries are compliant. And what I mean by that is that they cannot be leading. We can't tell the doctor, hey, if you were to document just a little bit more, we could get you to a higher level of code or anything like that, right? We could never mention the potential financial implications of any kind of response to a query or a documentation amendment. So compliance is extremely important when it comes to queries. AHIMA and ACTIS, AHIMA is the American Health Information Management Association. They're the ones that offer the CCS, Certified Coding Specialist examination. That's AHIMA. ACTIS is the Association of Clinical Documentation Integrity Specialists. They have that CDI in their name. CDI is Clinical Documentation Integrity, right? So here we're talking about CDI. They're really wanting to make sure that our documentation is complete and compliant, supports our codes, and so does AHIMA. So these are two completely separate organizations, but in this case, they came together to create these guidelines. This says the last time they updated this was in 2022, so this is the most up-to-date one. We're in 2026 now, so this is the most up-to-date guidelines as of now. So nothing's really changed in the last few years. Let's see. This is a big document. It's 26 pages. I'm not going to go through all of this. The module here will go through a lot more of that. But I wanted to just kind of touch on some of the high points here. Who should follow general query standards? Okay, query definition. Let me scroll down here. There's a lot of stuff. This is what I want to talk about here, when to query. So when to ask those questions. And usually when I'm teaching coders, you know, when you're coding and you're just kind of trucking along and you're assigning your codes and you're doing your thing, and then all of a sudden there's something in the documentation or something that just makes you stop, right? And you're like, oh man, wait, what? Is it right side or is it the left side? Or, hey, I can't support this code because I don't have the approach to the procedure documented, or maybe I don't have the size of the lesion documented, something like that, right? Something's missing, something's wrong, something's incomplete or conflicting. So generally speaking, that's what I tell coders is when to query is when, you know, you're going along doing your thing and all of a sudden you have to stop and kind of question yourself, like, hey, wait a minute, this doesn't make sense. My documentation isn't supporting this, or it's incomplete or conflicting. And that's kind of when you want to send a query. How do you send a query? And I don't believe they go over technically how to send a query in this document, because there are multiple different ways that you can send a query. It doesn't really talk about it kind of even at all here for when to query. It talks about like the different types of queries, multiple choice versus open-ended, that kind of thing. But when it comes to querying, when it comes to actually sending that question, there's a multiple different ways that we can do that. The thing is, well, let's take email, for example. There is a way that you can query via email. It's not typically, I've never used it because I've used it a little bit, but it's not, I think, as efficient as the other way. So querying via email is when you send the provider an email to have them amend the documentation. The thing is, when a provider answers a query, they typically have to amend the actual documentation. So just responding to your email isn't good enough, right? If their documentation says diabetes and pre-diabetes, then they actually have to go in there and change it, right? And confirm, well, was it diabetes or was it just pre-diabetes, right? So that's email. So I really don't like email as much because it's outside of the medical record. The other way is directly in the medical record. So in the electronic medical record, usually there's some sort of messaging system or a tasking system where you can send a task or a message to a provider, and in that message you have the query. You know, Dr. So-and-so, your documentation mentions that the patient has both prediabetes and diabetes. Can you please clarify this to, I'm in the documentation to clarify the diagnosis, something like that, right? And then that's part of the medical record. So again, because it's part of the medical record in that case, we have to be extremely careful to make sure we're compliant and non-leading, because it is something that can be auditable, right? It can be subpoenaed in terms of audit from OIG or a government audit or something like that. So very important to, again, always be compliant. So that's kind of how you do it, and how you do it will depend on your organization, of course. You can also do it, if you're in the office with the provider, you can say, hey, Dr. So-and-so, can you please amend this? It doesn't work. And then that provider can go ahead and amend the documentation. Ultimately, that's what we want, is correct and complete documentation, right? So that it can support codes that we can send to the payer. The format of queries, and it kind of talks about it here, under compliant query guidelines. It talks about providing multiple choice answer options. Provide multiple choice answer options. So, and I think there are some examples here. Hang on, let me scroll down. Again, this is a long document. Yeah, I'm not going to keep scrolling down just for the sake of time. But yes, you can have a multiple choice question like, hey, Dr. So-and-so, you, let me scroll up a little bit more here. Here we go. You documented this. Can you please clarify if the actual diagnosis is A, B, C, and then you always want to offer an open-ended option, right? So A would be diabetes, B would be prediabetes, C would be hypoglycemia, and then D would be other. And then you always have to allow the provider to, if you're providing a multiple choice question, you always have to allow that provider to add their own diagnosis, right, based off their own clinical determination of that patient's condition. So that's a multiple choice. It can also just be open-ended. Hey, doctor so-and-so, you documented diabetes and prediabetes. Can you please amend the documentation to clarify the condition? Something like that, right? It should be open-ended. And again, allow the provider just to say, hey, something's wrong with your documentation, and let's fix it. Okay, so there's some other stuff. Non-leading query statements must be accompanied by clinical indicators to the extent that you are capable of providing those clinical indicators as a coder. Let's see. Let's talk about templates again. So it can be kind of a lift, right? It can cause abrasion for the provider because the provider has to stop what they're doing and then answer these questions, right? It can also be kind of difficult for the coders because the coder has to stop what they're doing and write the question in the first place. And then what if the doctor doesn't respond? What do we do? I'll talk about that in a second. So let's talk about templates. Query templates can be helpful, right? So something, I used to work for an organization where we had, I don't know, 30 or 40 different templates. So it depends on kind of the coding that you're doing, the typical kind of procedures and documentation that you're seeing, the different queries that you're normally sending, and then creating templates off of those so that you can kind of plug and play those clinical indicators or diagnoses as you need to. And you don't have to write a query every single time from the very beginning, every single time you have to send a query. Let's talk really quickly about what if a provider doesn't respond, and then I'll kind of wrap this up. So what if you send a query and the provider does not respond? Usually a clinic or a practice will have a policy in place, or your coding team will have a policy in place. So you send a query to a clinician and you wait 5 days, for example, right? On day 5, if the provider has not responded, then you send them a reminder query. And wait 2 days. And if the provider still does not respond, then typically there's some sort of escalation process by which you can talk to your coding manager. The coding manager can talk to the clinic manager or the provider's manager or whatever the case is, so that we can get that query completed, because we need that query to be answered and the documentation amended so that we can send our codes, right? Worst case scenario, provider does not and never does answer your query. So if that's the case, you're looking at the potential, because the documentation is, again, still doesn't support the code, doesn't support, any of the code sent or that level of code or even the diagnoses. Worst case scenario is that it is not billable, right? Or parts of that scenario are not billable, and we've lost that charge. We've lost the diagnosis. So let's say it's diabetes versus prediabetes. We send a query to the doctor. He never responds to us. What do? Well, we can't send both of those conditions because they are conflicting. So we have to send neither of those conditions, report neither of those as diagnoses. So again, queries are really important for the reality of coding, to make sure that our provider documentation is complete and compliant, and that we, can ensure payment for the services that we are performing and that they are documented completely. Okay, well, that again is a really quick kind of rundown of compliant queries. There is a module here. It is long. There's a few questions here. But what I would really suggest is, again, making sure you download this link. It's going to, or click on that link. It's going to bring you to this PDF. Download this. I'm clicking on the announcements here. This is an announcement that I added, I think, yesterday. And there's a link here for that compliant query process here as well. So if you need anything, please reach out to me, and have a great week 3 and happy coding.